You wake up in the middle of the night, unable to move, feeling a heavy weight on your chest, and the room feels eerie, almost as if something sinister is lurking nearby. This terrifying experience is called sleep paralysis, and it's more common than you might think. But why does it happen? In this video, we're going to dive deep into the science behind sleep paralysis, explore the possible causes, and look at what you can do to avoid it. Be sure to subscribe for more fascinating insights into the mysteries of the mind and body. What is sleep paralysis? Sleep paralysis is a phenomenon where you temporarily experience an inability to move or speak while transitioning between sleep and wakefulness. It usually occurs when you're waking up or falling asleep, and during this state, you might also experience vivid hallucinations. These hallucinations can be terrifying and may involve seeing shadowy figures, feeling a presence in the room, or even hearing strange noises. Although sleep paralysis can happen to anyone, it's especially common in people who have irregular sleep patterns or suffer from sleep disorders. It can last for a few seconds to a few minutes, and while it's not typically harmful, the experience can be very frightening, leaving many wondering why it happens. The science behind sleep paralysis. To understand why sleep paralysis occurs, we need to first look at the stages of sleep. During a normal sleep cycle, we pass through several stages, one of which is known as rapid eye movement sleep. Rapid eye movement sleep is the stage of sleep where most dreaming happens, and it's also when your brain is highly active. However, while your brain is in overdrive during rapid eye movement sleep, your body is actually in a state of paralysis, a mechanism called rapid eye movement atonia. This temporary paralysis prevents us from physically acting out our dreams, which could be dangerous if we were to move during an intense dream. Sleep paralysis happens when your mind wakes up before your body's paralysis mechanism has worn off. In this scenario, your brain is awake and conscious, but your body remains temporarily paralyzed, leading to that sensation of being trapped in your own body. This is why sleep paralysis is often accompanied by a feeling of helplessness. The connection between sleep disorders and sleep paralysis. Certain sleep disorders can make sleep paralysis more likely. Here are a few of the most common. Narcolepsy is a condition where the brain has difficulty regulating the sleep-wake cycle. People with narcolepsy often experience excessive daytime sleepiness and can enter REM sleep very quickly, making them more prone to sleep paralysis. People who suffer from insomnia often have disrupted sleep patterns, and irregular sleep cycles can increase the chances of experiencing sleep paralysis. Poor sleep quality and sleep deprivation can contribute to this disorder. Sleep apnea occurs when breathing is repeatedly interrupted during sleep. These breathing disruptions can lead to fragmented sleep, which increases the likelihood of experiencing sleep paralysis. Psychological factors and stress. While sleep disorders play a significant role, stress and anxiety can also trigger sleep paralysis. High stress levels and anxiety can disrupt your sleep cycle and make it more difficult to enter restorative sleep. When your mind is racing or you're overwhelmed with worry, it can interfere with the transition between sleep and wakefulness, increasing the likelihood of sleep paralysis. In fact, people who are dealing with major life stressors, trauma, or emotional strain are more likely to experience this phenomenon. Additionally, sleep paralysis has been linked to sleep deprivation, which can cause the brain to become overly alert while the body is still in a state of rest. If you're not getting enough sleep, the chances of experiencing sleep paralysis become higher. Sleep paralysis and hallucinations. One of the most disturbing aspects of sleep paralysis is the vivid hallucinations that often accompany it. These hallucinations can range from visual to auditory, and they often involve dark, shadowy figures or the feeling of someone or something in the room with you. Many people report seeing a figure sitting on their chest, which can feel like a suffocating weight. These hallucinations occur because during sleep paralysis, your mind is awake while your body is still in a dreamlike state. This creates a blend of reality and dreamlike experiences. Your brain may try to make sense of the paralysis by creating images or sounds, leading to the terrifying sensations of being watched or even attacked. The sensations of pressure or suffocation are often a result of the body's inability to move, coupled with the brain's perception of threat. The feeling of an oppressive presence is commonly reported in many cases of sleep paralysis, and it may be rooted in the brain's attempt to explain the experience during this half-wake, half-sleep state. Cultural and superstitious interpretations of sleep paralysis. Throughout history, sleep paralysis has been interpreted in many ways by different cultures. The phenomenon has been described in folklore as being the result of evil spirits, ghosts, or demons. In fact, sleep paralysis has been linked to various supernatural beliefs, including the old hag syndrome. In parts of North America and the Caribbean, sleep paralysis has been linked to the myth of an old hag or witch who sits on a person's chest while they sleep, preventing them from breathing looming, or moving. Shadow people. Many cultures have described the sensation of a shadowy figure or dark being in the room during sleep paralysis. This entity is often described as malevolent or threatening, fueling fears and anxiety surrounding the experience. Nightmares and incubus. In some cultures, sleep paralysis was believed to be caused by demons or spirits that would physically overpower a person during their sleep. These demonic figures were said to sit on the chest of the sleeper, making it difficult to breathe. While these interpretations may have been ways to explain the frightening experience of sleep paralysis and the absence of scientific knowledge, they also highlight how universal the phenomenon has been across cultures and time periods. What you can do to prevent sleep paralysis. Although sleep paralysis can feel incredibly disturbing, there are several things you can do to reduce the likelihood of experiencing it. One of the most effective ways to prevent sleep paralysis is to maintain a consistent sleep schedule. Try to go to bed and wake up at the same time every day, and aim for at least 7 to 9 hours of sleep per night. Since stress is a major trigger for sleep paralysis, finding ways to manage stress can significantly reduce the chances of experiencing it. Practices like mindfulness, meditation, yoga, or even a warm bath before bed can help relax your mind and body. Ensuring that you get quality sleep is essential. Try to avoid caffeine, heavy meals, and excessive screen time before bed. Create a calm and relaxing sleep environment to promote restful sleep. Some people find that sleeping on their back increases the likelihood of experiencing sleep paralysis. Sleeping on your side can help reduce the pressure on your chest and prevent triggering the paralysis response. If sleep paralysis is occurring frequently or is accompanied by other sleep-related disorders like narcolepsy or sleep apnea, it may be worth consulting a healthcare provider. They can help you address the underlying causes and provide appropriate treatment. Understanding sleep paralysis. Sleep paralysis is a phenomenon that many of us have experienced at some point, and while it can be terrifying, it's important to remember that it's not harmful. By understanding the science behind sleep paralysis and the factors that contribute to it, you can take steps to minimize the occurrence of these episodes. Whether it's through better sleep habits, stress management, or seeking professional help, there are ways to gain control over this unsettling experience. If you've ever experienced sleep paralysis, you know just how frightening it can be. But now that you understand the science and psychology behind it, you can take steps to prevent or reduce its occurrence. Don't forget to subscribe for more insights into fascinating topics like these, and share your experiences with sleep paralysis in the comments below. Your story could help someone else who's been through the same thing.